In parasitology, helminths are parasitic worms that infect humans and animals. There are a few important terms to understand. An intermediate host is one that carries the larval form of a parasite, while the definitive host contains the adult, sexually reproducing form. Some helminths are hermaphroditic, meaning they contain both sexes within one organism. This is true for cestodes and nematodes, with the exception of the schistosomes. A gravid proglottid refers to a tapeworm segment that is filled with eggs. When we talk about intestinal nematodes, or roundworms, there are some general features. The males are usually smaller than the females and have a curved tail. Nematodes are unsegmented, and their length can range from just a few millimeters to several meters. They possess a complete digestive tract, extending from the mouth to the anus, and they are found worldwide. One of the best-known nematodes is Ascaris lumbricoides, also called the large intestinal roundworm. It is the largest nematode and the second most common in the United States. Infection occurs when infective eggs are ingested. Clinically, it can cause a worm ball, leading to intestinal blockage or Ascaris pneumonitis when larvae migrate through the lungs. Diagnosis is made by demonstrating adult worms or identifying characteristic eggs in feces. These eggs are round with a thick albuminous coating. Though sometimes the coating is lost, leading to decorticated eggs. Larvae may also be found in sputum or gastric washings. If no males are present in the intestine, unfertilized eggs may be passed. A related parasite, Toxocara canis or Toxocara cati, infects dogs and cats. But in humans, larval migration through tissues produces visceral larval migrans, associated with high eosinophil counts. Enterobius vermicularis, or pinworm, is the most common helminth parasite in humans, especially among children. Infection occurs when eggs are ingested. Symptoms include intense perianal itching. Diagnosis is made using the Scotch tape, or cellulose tape, preparation, which picks up eggs and larvae deposited at night when the female worm migrates to the perianal folds. Adults may also be seen on the surface of stool. Eggs become infectious within hours, making autoinfection common. Because of this, treatment must extend to the entire family. Trichoris trichiura, known as whipworm, can cause prolapsed rectum in heavy infections. Its eggs, which are football-shaped with distinct polar plugs, are diagnostic when found in feces. Strongyloides stercoralis, or threadworm, is the smallest intestinal nematode. It has two larval forms. The rhabditiform larva is non-infective, has a short buccal cavity, and prominent genital primordium. The filariform larva, which is the infective stage, penetrates the skin and can be identified by a short buccal cavity and a notched tail. Eggs hatch in the intestinal mucosa and are rarely seen in feces. This parasite can alternate between a free living cycle and a parasitic cycle. Importantly, strongyloides can cause autoinfection when rhabditiform larvae transform into filariform larvae inside the bowel. Disease progresses through 3 stages: a cutaneous phase at the site of entry, a pulmonary phase during larval migration through the lungs, and an intestinal phase with variable symptoms. Immunocompromised patients may develop hyperinfection syndrome, with widespread tissue invasion and fatal outcomes. Diagnosis is made by detecting larvae in stool. The hookworms include Necator americanus of the New World and Ankylostoma duodenale of the Old World. Adults attach firmly to the intestinal mucosa and can live for years. Their larvae also have rhabditiform and filariform stages, but unlike strongyloides, they have a long buccal cavity. Filariform larvae are the infective stage, which penetrates the skin. Clinical disease includes pneumonitis, ground itch, and anemia, because each adult worm consumes a measurable amount of blood daily. Eggs can be seen in stool, but larvae are absent unless the stool is left standing at room temperature. In dogs and cats, Ankylostoma brasiliensis and Ankylostoma caninum cause cutaneous larval migrans, seen in humans as serpiginous tracks beneath the skin, also known as creeping eruption. Among the blood and tissue nematodes, Trichinella spiralis is acquired by ingesting encysted larvae in undercooked pork or wild game. Female worms release larvae, not eggs. Early symptoms may mimic food poisoning, followed by muscle invasion, especially in active muscle groups. Marked eosinophilia occurs and may reach extremely high levels. In severe infections, the myocardium can be involved. Diagnosis is confirmed by muscle biopsy showing encysted larvae, or by serology. When distinguishing between hookworm and Strongyloides larvae, remember the key differences. For the rhabdidiform larva, Strongyloides is described as short and sexy. It has a short buccal cavity and a prominent genital primordium. These features set it apart from hookworm rhabdidiforms. For the filariform larva, the tail provides the most useful clue. Hookworm larvae have a pointed tail, while Strongyloides larvae have a notched tail. So the quick memory aid is rhabdidiform Strongyloides, short buccal cavity, genitalia visible. Filariform hookworm, pointed tail. Filariform Strongyloides, notched tail. When distinguishing between the adult forms of hookworms, focus on the mouth parts. Necator americanus, the New World hookworm, has cutting plates instead of true teeth. These plates are flat, sharp edges used to attach to the intestinal mucosa. Ankylostoma duodenale, the Old World hookworm, has 2 pairs of prominent teeth. These teeth make it easy to differentiate from Necator. So the quick rule is Necator, cutting plates. Ankylostoma duodenale, 2 pairs of teeth.